This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This is part 16 in a 58-part video series. The entire book is covered from front to back, and we recommend that you review the introductory video in our channel to get the background. Our subject heading in this part is choline. Choline is something often overlooked, yet it is critical for heart failure recovery. Choline deficiency is widespread throughout our modern world, yet very few have ever heard of it. Estimates show that there is at least 80% of the population is deficient. It has a critical impact on neurological connections to the heart muscle to trigger proper heartbeat timing and strength. It speeds up heart muscle cell regeneration dramatically, and also third, it reduces the urinary loss of carnitine, which provides ATP energy boost to heart output. This is something that very few doctors and nutritionists have paid any attention to. Choline has only been considered an essential nutrient since 1998, when the Institute of Medicine recognized it as critical for child development. The minimum intake recommended is 550 milligrams for adults, men, and 425 milligrams for adult women. Very few Americans reach even this minimum intake. So in a study of 26 persons with the minimum intake, 6 persons still developed disease-related deficiencies. Choline works in heart failure recovery by increasing heart muscle strength and promoting regular heart contractions. It can lower your heart rate and reduce heart stress. It's a key ingredient in forming the cell walls of all living cells, and particularly the heart muscle cells that are being regenerated and replaced. The intake of choline prevents fatty liver disease. This is found in 1/3 of U.S. adults and 1/2 of men suffering from obesity. Severe choline deficiency leads to muscle damage in 80% of women and men tested. These diseases are all very simple to correct. The heart is working very hard, 4,200 times per hour, more than 100,000 beats per day, and those heart muscle cells require constant replacement through regeneration. A heart failure patient is suffering a far greater lack of heart muscle cells, therefore requiring extreme increase in replacement and production of heart muscle cells. Now, the choline content in your body is blocked from its therapeutic action by the presence of the hormone adrenaline. During the daytime, our normal stresses increase adrenaline output, leading to reduced choline levels in the bloodstream. Choline is highest when we are sleeping peacefully, and this marks one of the most critical aspects of successful heart failure recovery. Maintaining a calm, peaceful life with plenty of sleep, keeping your choline levels high, increases recovery speed. It also lowers blood pressure on the side. Choline is available in the supplemental tablets, and the upper recommended limit is 3,500 milligrams each day for adults. We're trying to recommend 1,000 milligrams per day minimum to 3,000 milligrams per day maximum. Choline is found in eggs, beef liver, and lecithin. The best lecithin for choline is one derived from sunflower seeds, because it uses far fewer chemicals as that which is used to extract lecithin from soybeans. Some women object to soybean products because of estrogen in the soybeans. I use 2 tablespoons of sunflower lecithin in powder form, which provides 2,500 milligrams of choline for a juice mixture every morning. This dramatically offsets the adrenaline production during the day, and then 500 milligrams can be taken in a tablet in the evening time, totaling 3,000 milligrams per day. Some neurologists have actually prescribed high levels of lecithin with choline for patients with brain function problems, essentially memory lapses. My wife actually was suffering from the inability to recall names and places a year ago. Just on a hunch, I increased the lecithin content in our morning juice to 3 tablespoons, and after 2 weeks, she improved to normal. I waited a couple of months before letting her know why she could remember everything again. And this is just a single case, not a clinical trial. This is just an example of what impact it can have, even in small increases in quantity. There was a recent false alarm study in 2011 in Nature magazine. They claim that choline can cause heart disease by increasing the risk of arteriosclerosis. The study was not based on scientific clinical facts, but mainly theories about choline reaction with intestinal bacteria to create trimethylamine inoxide, TMAO, in the blood. They recorded increased levels of TMAO in mice after feeding them choline chloride at levels of 500 to 1,000% above normal. Humans do not consume choline chloride. It is not available as a supplement. It was chosen simply to create a false alarm study because it is known to increase TMAO levels. An increase in TMAO can increase heart disease risk 2.5 times normal. However, humans do not consume choline chloride. The choline in the form of lecithin does not change TMAO levels. Fish contain the highest levels of TMAO, yet human populations with a diet rich in fish have lower than normal heart disease rates. So you have to be careful when you read a clinical study on animals and find there is no proof in relation to humans. Now remember, choline is not your typical amino acid or vitamin compound. It is classified as a nutrient, and the human body can make choline. However, as we grow older, we do not make enough to rebuild heart muscle cells. Adding it to your diet is just completely simple. You can buy pound jars of lecithin powder and simply spoon it into juice and blend it in with a blender. This concludes this part 16 of the Heart Failure Recovery Plan. My name is J. Randall Wilkerson. This book is available from Amazon in print and Kindle editions, from the Apple iTunes Store as an iBooks edition, from eBay as a print edition, and direct from the publisher Wilkerson and Hughes, P.O. Box 777, Altoona, Florida 32702. It's postpaid for $24. Thank you for listening.